Here's something most people over 70 aren't told. If you're 75 and get a full body scan, there's a 90% chance doctors will find something abnormal. Sounds scary, right? Here's the truth. In most cases, it's completely harmless. A tiny cyst, a small nodule, a spot that would have never caused a single symptom. But once it's found, you can't unfind it. That's when the cycle begins. More tests, more scans, biopsies, sometimes even surgery, all for something your body was peacefully living with. I'm Dr. Robert Harrison, and after decades in medicine, I've seen this happen far too often. Today, I want to talk about 5 medical screenings that, after age 70, can sometimes do more harm than good. This isn't about avoiding healthcare, it's about being smart with it, because what helps at 50 doesn't always help at 80. Take full body scans. They sound reassuring, catch problems early, peace of mind. But studies show up to 40% of healthy adults who get these scans have incidental findings, things discovered by accident that would never have mattered. And if it's a CT scan, that's significant radiation exposure without a clear medical reason. Instead of scanning everything, what truly protects your health at this stage of life? A comprehensive geriatric assessment, checking your balance, your walking speed, your strength, your medications, your sleep, your social life. These predict your long-term health far better than a machine ever could. Now let's talk about brain MRIs for mild forgetfulness. Forgetting where you left your keys at 78? That's normal. Yet 94% of people over 75 who get a brain MRI show abnormalities. Mild shrinkage, white matter spots. But often that report simply means this brain belongs to someone in their late 70s. Aging is not a disease, and sometimes the most powerful decision you can make for your health is knowing when not to test. If you're over 70 or love someone who is, this information matters. Here's the part no one talks about. A brain scan can change your life even when nothing is actually wrong.
When a report says atrophy or white matter disease, it sounds like dementia. To you and your family, it feels like a diagnosis. Confidence drops. Fear moves in. You start second-guessing your own mind. But here's the truth. Those findings are incredibly common after 75 and often completely normal for your age. And even more important, they don't change treatment for mild forgetfulness. There's no pill that reverses normal age-related brain changes, so the scan doesn't fix anything. It just creates anxiety. A better first step? Simple cognitive testing in your doctor's office. Quick tools like the mini mental state exam or the Montreal Cognitive Assessment take about 10 minutes. They measure how your brain is actually functioning, not just how it looks in a picture. And if there is a problem, we look for reversible causes first. Low vitamin B12, thyroid imbalance, depression, sleep apnea, medication side effects. These are common and many are treatable. Now, let's talk about the heart. Routine stress tests in seniors without symptoms often create false alarms. As we age, normal changes in the heart can make tests look abnormal, even when arteries are fine. And a false positive doesn't end there. It can lead to invasive procedures like cardiac catheterization with real risks, bleeding, kidney damage, artery injury. If you can walk briskly, climb stairs, and live actively without chest pain, you're already passing a stress test every day. Sometimes the smarter move is focused prevention, blood pressure control, cholesterol management, movement, diet. Next, colonoscopy after 75 or 80. Colonoscopy is life-saving at the right age, but its benefit is preventing cancer 5 to 10 years down the road. If someone's life expectancy is shorter than that, the risks may outweigh the benefit. Preparation can cause dehydration, sedation can trigger confusion, and in older adults, the risk of colon perforation increases, which can mean emergency surgery. That's why major guidelines recommend individual decisions after 75 and stopping routine screening after 85. After that, the focus shifts. Know the warning signs, report symptoms quickly, and protect your colon daily with fiber-rich foods, fruits, vegetables, beans, whole grains. Finally, PSA testing after 70. Prostate cancer often grows very slowly in older men. In fact, many men in their 80s have prostate cancer, but die from something completely unrelated. The PSA test can't reliably tell the difference between a harmless, slow-growing cancer and an aggressive one. And once it's found, treatment can mean surgery, incontinence, sexual dysfunction for a cancer that may never have caused harm. This is the pattern.
Test, find something, treat something, worry about something, even when the body was doing just fine. Smart healthcare after 70 isn't about doing more. It's about doing what truly matters. Because aging isn't a disease, and sometimes the most powerful medical decision is knowing when not to test. Here's the hard truth about prostate cancer screening after 70. Once you tell a man he has cancer, everything changes. Even if that cancer was slow growing, even if it never would have caused harm, even if he would have lived his entire life without knowing it was there, the word alone is enough. And once it's spoken, most men feel they have no choice. It must be treated. But treatment for prostate cancer is not minor. Surgery can mean permanent urinary incontinence. Radiation can cause erectile dysfunction. Both can dramatically change quality of life. And here's what the evidence shows. The U.S. Preventative Services Task Force reviewed decades of data and concluded that for men 70 and older, the harms of routine PSA screening often outweigh the benefits. Why? Because the chance of finding a cancer that would actually take your life is small, but the chance of overdiagnosis and life-altering treatment is much higher. In fact, overdiagnosis rates are estimated to be more than 15 times higher in men over 85 compared to men in their 50s. Now, does family history matter? Absolutely. Does personal risk matter? Yes. But that means the decision should be a conversation, not an automatic blood test ordered without discussion. An honest talk between you and your doctor about your actual risk, your overall health, your life expectancy, and most importantly, what matters to you. For many men diagnosed with very low-risk prostate cancer, the smartest option isn't surgery. It's active surveillance. That means monitoring carefully, regular PSA checks, occasional follow-up, and only treating if the cancer shows signs of becoming aggressive. No unnecessary side effects, no rushing into life-changing procedures for something unlikely to harm you. And when you step back, you begin to see the pattern. Whole body scans that find harmless abnormalities, brain MRIs that create fear without changing treatment, stress tests that trigger invasive follow-ups after false alarms, colonoscopy late in life when benefit is minimal, PSA testing that leads to overtreatment of slow-growing disease. What connects all of these? They're searches for problems in people who feel fine. And as we age, that kind of searching becomes less helpful and more likely to cause harm. This isn't about avoiding medicine, it's about practicing smarter medicine. After 70, the goal of healthcare shifts. It's no longer about finding every possible abnormality. It's about maintaining function, independence, clarity, mobility, connection, joy. A comprehensive geriatric assessment tells us more than a full body scan ever could. A 10-minute cognitive test tells us more than a brain MRI for mild forgetfulness. A thoughtful discussion tells us more than an automatic PSA order. Sometimes the most powerful thing a doctor can do is not order the test, but sit down, listen carefully, and ask, what matters most to you? And you have the right to ask questions too. When a test is recommended, you can say, what will we do differently based on the result? What are the risks? What happens if I choose not to do this? Those are not confrontational questions. They are wise questions. Medical care should be a partnership. You bring your values, your goals, your lived experience. Your doctor brings medical knowledge. Together, you make decisions that fit you, not just a guideline. Because the goal isn't simply to live longer, it's to live well, with dignity, with independence, with strength, with peace of mind. And sometimes the way you protect that life is by knowing when to say no.
If this resonated with you, share it with someone who needs to hear it. And I'd love to know, have you ever felt pressured into a medical test you weren't sure about? How did you handle it? Until next time, stay well. And remember, smart healthcare means knowing when to say yes and when to say no.